Thank you, Dr. McCullough. Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony?
Yes, I do.
Thank you.
Dr. McCullough, we know you're a cardiologist, an internist, an epidemiologist. Could you start by giving a summary of your qualifications and experience?
I'll do so quickly. I'm in practice in Dallas, Texas, in internal medicine and cardiology. I hold degrees from Baylor University, the University of Texas Southwestern Medical School, the University of Michigan School of Public Health, and Southern Methodist University Graduate School. I've been in practice now for greater than 4 decades, and I have published extensively on the interface between heart and kidney disease in the last 3 years, have directed my clinical and research focus on COVID-19. I have over 60 peer-reviewed papers on SARS-CoV-2 infection, COVID-19 illness, and I've commented extensively in the U.S. Senate, multiple state senates, as well as in the media.
Thank you. And Dr. McCullough, you also have a clinical practice whereby you've had opportunity to treat COVID-19 or vaccinated patients?
Yes.
Okay, I want to turn to SARS-CoV-2, Dr. McCullough. The government of Canada determined in the early stages of the COVID crisis, so in and around early March 2020, that the virus was highly transmissible and virulent pathogen with an approximate 1% fatality rate, for which there was no natural immunity and no effective antivirals. Can you comment on those conclusions?
I disagree with those. The SARS-CoV-2 infection was one that was early on well characterized. It was highly transmissible from symptomatic person to susceptible person. It had an overall case fatality rate far less than 1%, available to risk stratification, so the elderly, those with multiple risk factors at risk for death. And we knew early on that the virus was amenable to antivirals and, more importantly, use of drugs to reduce inflammation and thrombosis. So within a few months of the onset of the pandemic, myself and researchers had already synthesized and then quickly published the first peer-reviewed paper describing the treatment of SARS-CoV-2 infection at home to reduce the risk of hospitalization and death, and that was ultimately well supported over the next few months with multiple comparative studies.
Thank you. What do we know about the virulence of the virus now, Dr. McCullough?
It's greatly reduced with the continued progression of mutations to the Omicron and the subvariants.